my dear friends, welcome back to my channel. Today I am going to discuss some important multiple choice questions in the field of prosthodontics. In this lecture I would like to share some important MCQs related to the topic orientation jaw relation. So coming to the questions. Orientation records are transferred by A. Gothicage tracing, B. Facebook record, C. dual impression technique, and D. any of the above. What is the answer? Coming to some discussion. The orientation jaw relation is the first jaw relation to be recorded, and it establishes the relationship of the maxilla to the base of the skull or cranium. So here it is the schematic diagram showing the orientation of maxilla in relation to the base of the skull. Okay. Here this is the picture showing the tilt of the maxilla. And these red lines which shows the existing tilt or inclination of maxilla in relation to the cranium. Okay, this is the relationship of maxilla to the cranium. These red lines shows. Okay, and the tilt which can vary with every individual, that is green line. This is the green line, and this tilt needs to be recorded and transferred to an articulator to obtain accurate jaw relation records, and this tilt is recorded using a Facebook. Okay, so to record the angulation of the maxilla, a plane should be formed. Okay, with at least two posterior references and one anterior reference. Here it is the view of a head from top. To record the inclination of maxilla, a plane should be formed with two posterior, that is the center of both condyles A and B, and one anterior point, here the infraorbital notch, that is C, which is used as the anterior reference point. Here the picture shows the face bow which is used to determine the inclination of maxilla by forming a plane, that is A to C, using the center of two condyles as in the condyles in the both sides. Okay, as posterior references and the infraorbital notch. Here it is the infraorbital notch is that used as an anterior reference. So this is the triangle. Okay, so here is A, C and B. B is the infraorbital notch, that is anterior point of reference. A and C is the center of condyles. Hence the center of condylar rotation is determined and the same is transferred to the articulator. Once the maxilla is oriented, mandible is oriented with the maxilla using the centric and eccentric records. This is the face bow. Here is the articulator, and this is the infraorbital notch, and this is the center of condyle. Okay. So the instrument used to record the center of condylar rotation along with the third reference point, thereby forming a plane to record the orientation relationship of maxilla to the cranium, is face bow. Okay. So what is the answer? The orientation records are transferred by face bow record. Okay. Before an accurate face bow transfer record can be made on a patient, which of the following must be determined? Inclination of each condyle, centric relation, vertical dimension of occlusion, and location of the hinge axis point. Coming to its discussion. What is the face bow? Actually, according to Snow in 1802, it is defined as a caliper-like device. Okay, here it is a caliper-like device which is used to record the relationship of maxilla or mandible to the temporomandibular joint. According to GPT-9, the face bow is defined as an instrument which is used to record the spatial relationship of the maxillary arch to some anatomic reference point or points, and then it transferred to an articulator. Okay, then transfer this relationship to an articulator, and it orients the dental cast in the same relationship to the opening axis of the articulator. Customarily, the anatomic references are the mandibular transverse horizontal axis and one other selected anterior reference point. So this is the very important definition for face bow according to GPT-9. So if anyone asked you to define the face bow, then you must thoroughly define this term in the GPT-9. Okay. So which are the types of face bow? It is arbitrary and kinematic or hinge axis face bows. And another types are fissure type and earpiece type, on which earpiece type can be Hanno spring bow, SLIDEMATIC or dinar, Geissy face bow, TWIRL bow and whip mix face bow. So what is an arbitrary face bow? The hinge axis is approximately located in this type of face bow. This is the Ritchie condyle marking. The arbitrary face bow is used for complete denture construction. And this type of face bow generally locate the true hinge axis within a range of 5 mm. Okay. This is the kinematic face bow or actual value or actual hinge axis. It is used to determine and locate the exact hinge axis points. And hinge axis of the mandible can be determined by a clutch. That is a segmented impression tray-like device which is attached onto the mandibular teeth with a suitable rigid material such as impression plastic. And the whip mix face bow, that is the earpiece type of face bow. It has a built-in hinge axis locator. It automatically locates the hinge axis when the earpieces are placed in the external auditory meatus. And it has a nasion relator assembly. This is the nasion relator assembly with a plastic nosepiece. Okay. So this is the whip mix face bow. So this is the SWAT instrument which is used to make the pantographic recordings. So this is the SWAT instrument. Here this picture shows the pantographic tracings which made by the SWAT instrument. Okay. So before an accurate face bow transfer record, the record which is made on a patient, the location of hinge axis point must be determined. So that is the important MCQ. Okay. So next question is Hanno articulator which has the condylar guidance as lower member, upper member, any of the above and none of the above. As we already know, there are very many types of Hanno semi-adjustable articulators are available. So this one is the Hanno wide view articulator and this is the Hanno H2 articulator. We can note the differences, the condylar guidance, that is here it is in the lower member and here it is in the upper member. So in the lower member in Hanno wide view articulator and in the upper member in the Hanno H2 articulator. So the answer is the lower member or upper member, that is any of the above. Okay. Following articulators will accept face bow transfer except kinescope articulator, Gritchman articulator, dentatus articulator, dinar articulator, SWAT articulator. Which one is the answer? So which are the types of articulator? This one is the kinescope articulator. Here it is the Gritchman articulator. This is the dentatus articulator, SWAT articulator and the dinar D5A articulator. So this is the kinescope, dentatus, SWAT and dinar D5A and this is the Gritchman articulator. So the all other articulators which can accept the face bow transfer except Gritchman articulator. So the answer is the Gritchman articulator. All others can accept face bow tracts. TWIRL bow relates maxilla to axis orbital plane, alar tragus plane, Frankfurt horizontal plane and horizontal occlusal plane. Which one is the answer? So TWIRL bow is a type of face. No. So what is the TWIRL bow? It is an earpiece type of face bow. It allows the maxillary arch to be transferred to the articulator without physically attaching the face bow to the articulator. And it relates the maxillary arch to the FH plane, that is Frankfurt horizontal plane. So what is the answer? The TWIRL bow relates the maxilla to the Frankfurt horizontal plane. Okay. So coming to the Dinard reference plane locator. What does it locate? Anterior reference point, a point 15 mm anterior to the external auditory meatus, posterior reference point, both A and C. These are the anterior reference points. Which are the anterior reference points? This one is the nasion, which is used with the kip-mount face bow or whip-mix face bow. Then the orbital, which is located by the Hanau face bow with the help of a orbital pointer, that is fascia type or earpiece type. Then orbital minus 7 mm, this plane represents the Frankfurt plane. Then the ella of the nose, which represents the campus plane, and the 43 mm superior to the lower border of upper lip. This point is located by using a Dinard reference plane locator. Okay, here the Dinard or SLIDEMATIC face bow which uses this point. And these are the posterior reference points, that is Baron's point, Geissy point, Snow's point, then Dinard point, Bergstrom point. Okay, these are the various posterior reference points. So this is the Dinard reference plane locator. This one is that. Okay. And the Dinard or SLIDEMATIC face bow which uses this reference point. Here it is the posterior reference point and this is the anterior reference point. Okay. And the posterior reference point is that this is the external auditory meatus. And the anterior reference point is that 43 mm superior to the inside the ledge of the upper central incisor for dentulous patients, and the 43 mm superior to the lower border of upper lip in the edentulous patients. It is in a relaxed state. And the anterior reference point is also used for the whip-mix articulators. And the anterior reference point can be marked using a Dinard reference plane locator. And the plane locator is an instrument which resembles the face. Okay. And in this picture it shows the reference rod index. This one is the reference rod index. This is the 43 mm notch. Here it is the millimeter scale. And this hole which represents the posterior reference point hole. Hence the Dinard reference plane locator which locates the anterior reference point as well as the posterior reference point. So both A and C is the correct answer. Okay. Coming to the next question, that is anterior reference point for the SLIDEMATIC face bow is 34 mm above the incisal edge of right central incisor, 43 mm above lower border of upper lip, 43 mm above upper border of upper lip, 26 mm above lower border of upper lip. Which one is the answer? As we already said, the posterior reference point is the external auditory meatus and the anterior reference point is the 43 mm superior to the incisal edge of upper central incisor for dentulous patients, and for edentulous patient it is 43 mm superior to the lower border of upper lip in a relaxed state. So this is the Dinard reference plane locator which locates the anterior reference point. Okay. This is the SLIDEMATIC face bow, which is the type of earpiece face bow. This is used with the Dinard articulator or Dinard reference plane locator is used. it has an electronic device which gives the reading denoting 1/2 of the intercondylar distance. So what is the answer? It is 43 mm above the lower border of upper lip. The position of upper occlusal rim in the articulator is adjusted by. Arbitrary means using a face bow, adjusting intercondylar distance, adjusting incisal plane. Here the face bow is used to orient the maxillary cast to the temporomandibular joints. So the position of upper occlusal rim is adjusted by using a face bow. Okay. So here the bite fork which is attached to the maxillary occlusal rim by heating the tines and piercing them fully into the wax rim. And these tines, these are the tines which is parallel to the occlusal rim, which is parallel to the occlusal plane, 3 mm from the occlusal surface, and it shall not distort the occlusal surface. So the bite fork is mildly warmed on a burner and slowly inserted into the maxillary occlusal rim, 3 mm above and parallel to the occlusal plane. The center of the fork should coincide with the patient's midline. Here this is the patient's midline and this is the center of the fork which is coincide with the patient's midline. And the stem of the bite fork shall be at the patient's left and be approximately parallel to the sagittal plane. Here it is the wax rim. This is the tines of the fork. Here it's heat and pierce into the rim. This is the stem at the left. Okay, this is the sagittal plane and this is parallel to the sagittal plane. Here the occlusal rim with attached bite fork is inserted into the patient's mouth and verified. And the assembly shall form a rigid occlusal rim bite fork stem assembly as though in one piece. It do not distort the occlusal surface. So coming to the next question, that is the Ritchie condylar marker is used to scribe an arc 10 mm anterior to the external auditory meatus, 13 mm anterior to the external auditory meatus to determine the axis orbital plane and to determine the FH plane. What is the answer? This is the Ritchie condylar marking. Okay, here is the Ritchie condylar marking. This is the external auditory meatus, and what does this point? This point is the 13 mm. Okay, 13 mm which is anterior to the external auditory meatus on a line running from this is the outer canthus of eye. Here it is the outer canthus of eye and this is the external auditory meatus. This is the tragus area. Okay, so the tragus to the outer canthus of eye. This line is known as the canthotragal line. And the line drawn, the canthotragal line, and this line, that is the approximately 13 mm anterior to the external auditory meatus on a line running from the outer canthus of eye to the top of the tragus is called the Ritchie condylar marker. So this is the Ritchie condylar marker which is used to draw this line. And this is not done for earpiece type of face bow because the earpieces are inserted into the external auditory meatus itself. So it is not done for the earpiece type of face bow. This is the Ritchie condylar marking, or the marker is used. Okay. So what is the answer? To scribe an arc 13 mm anterior to the external auditory meatus. The plaster index is used to maintain the vertical dimension of occlusion, maintain bite registration, preserve the face bow transfer, all of the above. So what is the answer? Preserve the face bow transfer. All of the statements are true concerning a face bow or a face bow transfer except one. Which is the exception? A face bow is a caliper-like device which is used to record the patient's maxilla or hinge axis relationship. If the transfer is done properly, the arc of closure on the articulator should duplicate that exhibited by the patient. Face bow transfer is the maxillomandibular record. The face bow transfer the maxilla hinge axis relationship to the articulator during the mounting of the maxillary cast. What is the answer? the Facebook transfer is a maxillomandibular record. This is a false statement. Whereas the Facebook is a caliper-like device used to record the patient's maxilla or hinge axis relationship. And if the transfer is done properly, the arc of closure on the articulator should duplicate that exhibited by the patient. And Facebook transfer the maxilla only. Okay, maxilla hinge axis relationship to the articulator during the mounting of the maxillary cusp. So the Facebook transfer is only maxilla to the cranium relation. Okay, not a maxillomandibular record. That's all for today's lecture. Please do like, share and subscribe my channel for more videos. And thanks for watching. Stay home, stay safe.